Hand washing is a major issue afflicting hospitals in the U.S. The poor adherence to hand washing guidelines leads to more than 2.5 million hospital-acquired infections and $4.5 billion in related medical expenses each year. The most commonly transmitted organisms are C. difficile and MRSA. This graph illustrates the VA ICU hospital-acquired infection rates per quarter. Boyce and Pitt report that on average, pediatric wards have an average of 8 opportunities for hand hygiene per hour of patient care, compared with an average of 20 hand-washing opportunities for nurses in intensive care units. Therefore, ICU nurses are required to wash their hands more often per hour and have sicker patients who are more prone to infection, which leads to greater opportunity for hospital-acquired infections. With that said, the hand-washing compliance was only 68% at the VA, which leaves a great deal of room for improvement. As noted on a previous slide, C. difficile is one of the top 2 most commonly spread organisms in the hospital. This would account for the elevated C. diff rates and ease in spread of infection with poor hand-washing compliance. This year, C. diff rates have soared past previous years, indicating interventions must be taken to reduce rates and protect patients. Hand hygiene is cited as being the most effective means of reducing hospital-acquired infections. Wandel, Mays, LeBeau, Verrakeen, and Blott write that the most successful interventions appear to be ones that include different paths in achieving a behavioral change. A combination of educational programs, the formation of a multidisciplinary quality improvement team, compliance monitoring, and feedback have already proven effective. Using this knowledge, I will propose a multifaceted approach to behavioral change related to hand hygiene. The Centers for Disease Control and Prevention have issued guidelines for healthcare workers' hand hygiene in the hospital setting. Indications for hand hygiene include washing prior to patient contact and after patient care, after touching patient medical equipment, and after removing gloves. I'll now illustrate the hand washing process based on CDC guidelines. To begin, wet hands. Then apply the manufacturer's recommended amount of soap. Rub hands together for a minimum of 15 seconds. Singing Happy Birthday 2 times is a helpful reference for this. Be sure to scrub between fingers and on the backs of hands. Then rinse soap off of hands and use a disposable paper towel to dry. Be sure not to touch the faucet handles when turning off the sink. Rather, use your paper towel. The Institute for Healthcare Improvement has published a framework for quality improvements titled The Model for Improvement. The model is a step-by-step process from setting an aim through the implementation of changes. Utilizing the IHI framework, I aim to improve the rate of hand-washing compliance to 90% or above within 6 months through the use of educational training, shift hand-washing champions, and a yearly bonus incentive. Outcome measures are used to gauge the effectiveness of interventions. For my hand-washing initiative, I will monitor the hand-washing compliance of nursing staff as well as monitor rates of hospital-acquired infections, especially C. diff, which requires soap and water hand washing to prevent transmission. The first system change is to create an educational program for nursing staff. The indications and technique for hand washing will be reviewed. The program will be reviewed with staff every 6 months to refresh knowledge and promote compliance. Several staff members will also create before and after hand washing petri dishes to show the difference in bacterial growth. These images will be used as screensavers on workstation computers. Wandel et al. Write, feelings of unpleasantness or disgust lead to emotional sensations that invoke self-protection and therefore can help in improving one's attitude towards good hand hygiene practice. I hope that these images will lead to behavioral change in that way. I will create shift hand-washing champions to motivate staff and model appropriate hand-washing behavior. They will also screen for hand-washing compliance to gather data on compliance rates and find those individuals who require remedial intervention. The third change will be to link hand-washing compliance to yearly bonuses. There are currently 2 tiers, 500 for satisfactory and 1,000 for outstanding performance. To incentivize positive behavior, those who are non-compliant with hand washing would not be eligible for the $1,000 reward. To evaluate my initiative, I will review the outcome measures which will reveal how successful my intervention is. I hope to gain feedback from the staff to find areas of weakness that I can use to improve the intervention. After several test cycles, I hope to eliminate the flaws so my intervention can be implemented.